How is osteoporosis fracture risk assessed during pregnancy? Understanding how doctors evaluate fracture risk during pregnancy can seem complex, but it's all about balancing safety and accuracy. During pregnancy, assessing fracture risk in women with osteoporosis involves a careful combination of medical history, physical examination, and sometimes imaging, all tailored to protect both mother and baby. First, a detailed fracture history is essential. If a woman has already experienced fragility fractures, especially in the spine or hips, her risk of future fractures is higher. The number of fractures at diagnosis also matters. Multiple fractures suggest a greater chance of additional fractures later, including during future pregnancies. This history helps doctors understand her unique situation and guides management. Bone density testing is a key tool in osteoporosis assessment. The most accurate method is dual energy X-ray absorptiometry, or DXA. It measures bone mineral density and helps predict fracture risk. However, because DXA involves a small amount of radiation, it is generally avoided during pregnancy unless absolutely necessary. If performed after delivery, results are interpreted using Z-scores, which compare bone density to others of the same age and sex. Low Z-scores indicate weaker bones and higher risk. Since DXA is often limited during pregnancy, clinicians relying more heavily on clinical risk factors. These include nutritional status, body mass index, lifestyle habits like smoking or physical activity, and calcium and vitamin D intake. Medical conditions or medications that affect bone health are also considered. For example, certain chronic illnesses or long-term use of steroids can weaken bones. Fracture risk calculators like the FRAX tool are commonly used to estimate the chance of breaking a bone within 10 years. But these tools were mainly designed for postmenopausal women and may not be as accurate during pregnancy. Therefore, healthcare providers use their judgment, combining risk scores with clinical insights. It's important to remember that pregnancy-related osteoporosis is rare, and each woman's situation is different. Healthcare professionals who specialize in bone health carefully evaluate each case, especially if future pregnancies are planned. Women with a history of fractures or low bone density should be counseled about their increased risk and the importance of maintaining good nutrition, physical activity, and regular follow-up. In summary, assessing fracture risk during pregnancy involves a thorough review of fracture history, cautious use of bone density testing when appropriate, and applying clinical judgment alongside risk assessment tools. This personalized approach helps ensure safe management of osteoporosis during this special time, always prioritizing the health of both mother and baby. Remember, always consult your healthcare provider for tailored advice and support.